Welcome back. Well, we have gotten questions about what really constitutes as a COVID death and whether hospitals get paid more for putting COVID on a death certificate.
Our Verify team is here to answer those questions. Here's Vanessa Rufus with the answer.
We've gotten a lot of questions about what really constitutes as a COVID death and whether hospitals get paid more for putting COVID on a death certificate. There's been some confusion since the CDC published its COVID-19 comorbidity report, and that shows 94% of COVID reported deaths from February to December of last year had more than one cause. Only 6% of death certificates listed COVID-19 as the only cause. So let's verify. Our sources, SCDHEC's Assistant State Epidemiologist Dr. Jane Kelly, Dr. Charles Breget with Novant Health, the North Carolina Department of Health and Human Services, and the CDC. So first, are COVID deaths being overestimated in North Carolina? Well, the North Carolina Department of Health and Human Services says the state's COVID deaths include people who had a positive COVID test and who passed away without fully recovering from COVID-19, and who had no alternative cause of death identified. Last year, national infectious disease expert Dr. Anthony Fauci testified before a Senate committee and said he thought COVID deaths were actually underreported. Dr. Breget agrees.
From what I have read, from CDC and a lot of other authorities around the world, is we are probably underestimating the number of deaths. And that's because some places, just don't test for it. Some people, die from what seems to be unusual circumstances, whether it's kidney failure or liver failure or an unusual brain infection or spinal cord infection or other things. And it may not be appreciated that it's COVID.
So we can verify that no, COVID deaths are not being overestimated in North Carolina. Keep in mind, too, the CDC's reporting guidance on COVID deaths is broader. It says in most COVID reported deaths, COVID is likely the underlying cause listed below the immediate cause. For example, COVID-19 could prompt lung failure, which is what ultimately causes the person to pass away. And that's where the reporting can get tricky. That brings us to our next question. Do hospitals get more money if a death is coded as a COVID death? Once again, in many cases, COVID is the contributing, but not the immediate cause of death. It's then up to the coroner or a medical official to determine the cause of death, not the hospital.
Hospitals are paid higher Medicare rates for COVID patients and their treatment. The hospital itself doesn't determine a cause of death. We are record keepers for death certificates as they're completed and filed by coroners or by medical physicians who certify, who determine whether an individual's cause of death was COVID related or not.
So we can verify that no, while hospitals are eligible for more reimbursements for COVID related services, they don't get more money for COVID deaths. Keep in mind, too, the CDC says since February of last year, the U.S. has had upwards of 750,000 more deaths than it would usually expect for that period of time. The country has lost at least 680,000 lives to COVID-19. With your Verify, I'm Vanessa Rufus.